All right, so it's called Regional Updates because I was late with my title. So I'm going to give you a little short update on what's going on in New Jersey. And primarily, I want to talk about the New Jersey One Health Task Force. Was something that was, this is the first state that legislated this, was started in 2021 when it was established. The S347A established the New Jersey One Health Task Force. What is it for? Basically to promote everything that Diane just talked about. Promote communication and between state agencies and scientists, and to study human health, animal health, earth sciences, and basically to prevent the worst from happening. This was the outcome of very strong advocacy from the Rutgers One Health Steering Committee, which I am now part of, but this was really started in 2016 by Gloria Bachman, is the head of the Human Health Program Institute at Rutgers, Robert Wood Johnson, and Emmy Poppy, a volunteer with the Women's Health, that really was the program coordinator, the community organizer, the lobbyist, if you will, that made it happen. And then also Sona Janasi, at the time an instructor at Rutgers with Robert Wood Johnson, also that really sort of pushed it forward. Where is this standing right now? It's a classical kind of situation where originally it was designed to be driven through the Department of Health, and it became kind of a hot potato. The Department of Health didn't want it. Eventually, the Department of Agriculture has taken it. We're now in 2024. There was just an announcement of an appointment for a sort of a job search for a manager to be running the program. So we're not anywhere just yet, but we're making progress. And really, the idea is to, sort of as I mentioned, sort of this task force objectives is everything that we want. So it's to foster communication, do proactive detection and prevention, and basically do education and community involvement, because it really takes a village. It takes us all to speak the same language. We really don't talk the same language. So do cross-disciplinary education to highlight individual roles, how can all come together, and basically a call for action to prevent things like COVID, like Ebola, like all of these other pathogens. But by the way, if you notice, first slide also had a nymphal black-legged tick, and here's the female black-legged tick. We'll talk a little bit more about ticks in a minute. But this is the picture that CDC sort of put together as a summary of what One Health is about. So this idea that you have pathogens that are basically, we're all animals, and in fact, most of them, like I remember now it is 80% or something of the infectious diseases are originally zoonoses. And so we have sort of more animals on the left and then people on the right, and you have sort of transmission from the animals to people. We're trying to protect people. We also want to protect animals. We eat them, we live with them, we interact with them. They're important for our environment. But the fact is that there's this other thing in here, which is vectors. So vectors are the thing I work with. I'm a bug person. I'm an entomologist. And they do this sort of shuffling. And so instead of spread between animals and people, we're talking about spread of disease, pathogens among animals and among people. So we have mosquitoes, and it is true that mosquitoes have a role in the ecosystem. The Aedes vexans, the inland freshwater mosquito, is the sole pollinator of an orchid in here, actually probably in Delaware, definitely in New Jersey. But the vast majority of mosquitoes we're actually concerned about are not from here. They're invasive species, and they can certainly go away. They shouldn't be here to start with without having any impact whatsoever on the ecosystem. And I want to make that point because that's one of the communication issues we need to be familiar with. So mosquitoes move or pathogens among animals. They also move them from animals to people. And then in some very few cases, they transmit them among people. Things like human malaria, lymphatic filariasis, they're transmitted they're unique now to humans. But they also can spill over from humans back to animals. So orangutans and gorillas are now infected with human malaria because there's so many people infected with human malaria that they bite the orangutans or the gorillas and they become infected with human malaria. So again, it goes back and forth. The other group of organisms I want to talk about are ticks, which also transmit primarily pathogens among animals, and then they can transmit them to people. And so let's start with mosquito-borne diseases. And I just want to sort of, in terms of a lot of language, let's go to a few sets of facts. Fact is that most recent epidemics of mosquito-borne disease are driven from a very few invasive mosquitoes. Epidemics. I'm not talking about sub-Saharan Africa, where there's a local mosquitoes and are transmitting local pathogens, very similar to, which I'll talk about next, Lyme. But right now, you're talking about things like West Nile virus or Zika or chikungunya or dengue. They're all transmitted by invasive mosquitoes, primarily the yellow fever mosquito, dengue mosquito, yellow Zika mosquito, Aedes aegypti, and to some extent also Aedes albopictus, the Asian tiger mosquito. Other fact is invasive mosquitoes develop primarily in artificial containers in people's backyards. They're not out in the forest. If they go to the forest, they get eaten because they don't know, they're not from here. They don't know how to deal with local predators. They're really exclusively dependent on our environment. And also, importantly, they're in private properties. And the kind of environment can be sort of poor, or it can be blue ribbon habitat. That all has invasive mosquitoes. So they actually move across yards, which means you can't control mosquitoes in your own yard. It has to take a community because they'll move across yards, not very far. They're not very strong flyers. So most of the movement of mosquitoes, these invasive mosquitoes, is done by us. We transport their eggs, we transport their larvae, transport them as adults. Organized mosquito control by district or county or federal agencies really cannot afford to enter every single private. Often they can't enter private properties and just they can't do it. It's really hard to do an area-wide by going into everybody's private yard. Mosquito-borne disease control, not talking about mosquito control, I'm talking about mosquito-borne disease control is almost exclusively reactive. We're responding after there was a West Nile virus case. We're responding after there was an outbreak of Zika, and is inefficient. And commercial mosquito control is pricey, and because it's pricey, it's sporadic. And if you have something that is sporadic, inefficient, and reactive, you're going to have the development of insecticide resistance. And so you're starting to see evolution of insecticide resistance. Since it's heritable, it just accumulates. So it's basically a big problem, but it's a problem that actually requires all of us to come up with a solution, and that solution is us. This is a program I developed in Maryland where we had communities use these, seems like this actually may have a pointer. Yeah, look at that, oh, cool. They have these these traps, which cost like $15. And basically the community, there's no scientists in here. This is the community, local homeowners, their children. This is the 4th of July. They did to be able to get everybody to buy and maintain these traps. They actually transformed them into there's like a little bell inside of it. It was just like a little big clong. I didn't think of it. The community thought of it. There's enormous potential information. They know each other. And basically they were able to create what we're calling community action through science, which is a science data community-based solution with minimal insecticides. Now this had zero funding for this. This was really just the community came finding me because they come talk to me about bugs. So they go talk to Diana when there's something like a rabid raccoon. They come talk to me when there's murder hornet or an assassin bug or a tick. You want to see why a tick bit me? I get that all the time because people are really worried about insects. I just now was responding to somebody that said, I have these bugs in my basement. What do I do? Probably cluster flies, probably has some sort of trash or a broken sewer in there, and I'm providing this kind of information on a daily basis. So the other thing we have is a gigantic problem. So Lyme disease, Lyme disease is basically epidemic in the Northeast and Midwest. How many of you know somebody that has had Lyme disease? Okay. How many of you know that besides Lyme disease, you have Anaplasma phagocytophilum, Babesia microti, Ehrlichia schiffensis, Ehrlichia ewingi, whatever is their relapsing fever, Borrelia miyamotoi, and many others. Panola mountain, Ehrlichia is kind of on the rise. So there's all of those are listed right there are transmitted by the same tick, and only by that tick, the black-legged tick. on the right. So if someone is bit by a black-legged tick and got Lyme disease, Lyme bacteria, potentially could be infected with other pathogens. And we're not really talking that much about those pathogens. Now, we all know, everybody understands that Lyme disease is a huge problem. We had 5,000 cases of Lyme disease in New Jersey just last year. But what we're really not talking about is these other pathogens. And the trend is increasing for these pathogens. In particular, you will notice this. So the numbers are going down. There was kind of a decline here, mostly because of a change in definition of spotted fever rickettsiosa. Rocky Mountain spotted fever really does not exist in the Northeast. I want to just, but there's very, if any cases, there's spotted fever rickettsiosis that basically serologically are very similar to rickettsia. They are rickettsia. So that change in definition to, instead of calling it Rocky Mountain spotted fever, calling it spotted fever rickettsiosis, really declined on this. But what has been continuously increasing is babesiosis. What is babesiosis? Babesiosis is an epicomplex, a parasite like malaria. So doxycycline doesn't do anything to it. And it's a protozoa, it has male and female, they have sex in the tick. The tick is actually the definitive host. There's actually a few other things, part of these pyroplasms. They have sort of pear-shaped appearance inside the blood cell right there. That's the pyroplasm. There's a blood cell, there's no nucleus. And so that's actually the parasite inside. There's also Talaria cytoxum that, for those of you veterinarians, are very familiar in terms of humans, of veterinary cases. And it's actually a really complicated set of parasites. It's not really a monophyletic. There's Babesia up here on the top. Sorry, there's Babesia up here on the top, so-called the big Babesia. And then you have the Babesia clade 1, Babesia microti. They're quite different from each other. And inside of this, you have Talaria and cytoxum. For those of you that have forgotten this part, ticks have to feed at every stage. And so the parasite can be transmitted transstadially or can then be transmitted transovarally from the adult to the egg. These big Babesia can be transmitted transovarally. This group of Babesia here cannot. Both of these groups can infect people. So we have cases of most of the Babesia we're familiar with is Babesia microti, but Babesia duncani, gibsoni, all of those which are big Babesia, there have been cases, or big Babesia, which is up there. There have been cases in humans. In Canada, it's mostly duncani that is responsible for Babesia cases. And so why is Babesia important? For veterinary standpoint, they're a huge history of why they're important. They've actually been almost complete eradication of cattle fever, Babesia bigemini. One of the big Babesias, actually, they're currently tick riders, which is an entire on the horse. That's the Rio Grande up there. And they're trying to maintain cattle from crossing the border because there is still Babesia bigemina in Mexico, and they're really trying to keep it from infiltrating into the US. From a human standpoint, medical significance, there is an emerging case. In New Jersey, there's been an increase of over 40% in the last 10 years. It's tick-borne, but it's also transmitted by a transfusion. And Delaware does not have, it's not right now mandatory to declare a case of Babesia. It is mandatory in New Jersey and other states, but not here. And it's also, and then only since 2019, there's been a detection of the parasite in transfusion. So people that have been, they are already pretty traumatized they need a transfusion, getting Babesia. It's actually one of the cases where you have mortality happen. So it can be transmitted by organ transplant, blood transfusion, and in pregnant women, it can be transmitted to the fetus. There is a case, it's actually a few cases now documented of someone pregnant transmitting the pathogen so that when the baby is born, it's infected with Babesia. It's not very common. I mean, we're talking about 300 cases in New Jersey of Babesia every year. Thank you. Now, what we're trying to do, we have a program called New Jersey Ticks for Science, ! Doing this. And what we're trying to do is creating tick-confident communities. We're trying to provide all this nasty information and basically say, but you can do something about it. Do not freak out. Do not go hide it under your bed. You need to basically be out there, explore nature, protect nature, and know what to do. So this program, that's a female Lone Star tick. I've been talking about black-legged ticks. And so what we do is we create a program. We're identifying the tick species. There's about 13 species of ticks in New Jersey, plus or minus. We've just got the Gulf Coast tick just became established in New Jersey. I think it's now 14. And so these are the primary ones that are more likely to bite people. So here's the 3 stages of a Lone Star tick. Here's a black-legged tick. This is the new Asian longhorn tick. Here's a brown dog tick, and this is an engorged Lone Star tick. You see the little dot right there? That's a female Lone Star tick. We talk about all the pathogens that can be transmitted. We explain that only black-legged ticks can transmit Lyme pathogen and Anaplasma. Also, I didn't mention Powassan virus. On the other hand, Lone Star ticks, which are very aggressive, can only transmit in real terms, 2 species of Ehrlichia. And we do the testing for free and provide that information to everybody that submits in New Jersey. Sorry. Then we provide a lot of information about tick bite prevention, tick removal, and overall, basically creating an atmosphere where people feel empowered to do something about it. Provide information on how to minimize tick habitat, how to protect yourself when you're going to tick habitat. And so this idea of tick confidence is really what we're going for. And what I'm here to try and do is that we're not medical doctors. When someone comes to me and says, I have a tick bite, and I tell them your tick was positive or your tick was negative, I always say, go talk to your healthcare provider. But unfortunately, often those healthcare providers don't know what to do with that information. They know, they basically, the person, I'm telling them, I'm getting all tick confident, they're all informed, they go talk to a health provider and they're getting bad information. And so what I would like to understand is, what can we do? Tell us what kind of messaging, what kind of language, what would be helpful to provide to the healthcare providers, to the public health officers, so that we minimize the amount of bad information that is out there about ticks. And that is my message. Thank you.